Law, and in this presentation, I will discuss the key factors that define anxiety disorders and explain the differences between generalized anxiety disorder and social anxiety disorder, and describe why specifiers and modifiers are essential when diagnosing. Understanding these distinctions is critical for accurate diagnosing and effective treatment planning. According to the DSM-5-TR from the American Psychiatric Association, anxiety disorders are characterized by excessive fear, anxiety, and related behavioral disturbances. Fear involves an emotional response to a real or perceived imminent threat. Anxiety is an anticipation of a future threat, often leading to tension, restlessness, and avoidance behaviors. These disorders differ based on the situations that trigger the anxiety and the content of the associated thoughts. Examples include generalized anxiety disorder, or GAD, social anxiety disorder, or SAD, phobias, separation anxiety disorder. These disorders can interfere significantly with daily functioning, relationships, and overall well-being. Although GAD and SAD involve excessive anxiety, they differ in focus, triggers, and diagnostic criteria. Generalized anxiety disorder, or GAD, individuals experience persistent, excessive worry about various domains: work, health, finances, or families. Symptoms include restlessness, fatigue, irritability, muscle tension, and sleep disturbances for at least 6 months. In social anxiety disorder, or SAD, the anxiety is specifically tied to social interactions or performance situations. Individuals fear being negatively evaluated, embarrassed, or humiliated in front of others. This leads to avoidance of social or performance settings. In summary, GAD is broad and pervasive, while SAD is situation specific. Specifiers and modifiers are vital for accurate diagnosis and treatment planning. They help clinicians describe the course, severity, and specific features of a disorder. For example, in GAD, specifying whether symptoms occur with panic attacks or during certain stressors can influence treatment. In SAD, noting whether it is performance-only type guides therapy focus. These distinctions improve clinical communication, allow for targeted interventions, and ensure insurance and research consistency. Without specifiers, diagnoses risk being too broad and can lead to inappropriate treatment plans. Treatment for anxiety disorders typically includes cognitive behavioral therapy, CBT, to challenge and reframe anxious thoughts, exposure therapy, particularly for social or phobic anxiety, medications such as SSRIs or benzodiazepines for short-term relief, early diagnosis, proper classification, and individualized treatment improve outcomes significantly. Understanding the nuances between disorders ensures the best care for each client. In summary, anxiety disorders are defined by excessive fear and anxiety that impair functioning. GAD involves general, persistent fear, while SAD centers on fear of social judgment. Specifiers and modifiers are essential to tailor treatment and communicate accurate clinical information. Thank you so much for watching and listening to Splitting the Anxiety Hairs video created by Martha Law. The references used in this video were American Psychiatric Association Diagnostic and Statistical Manual of Mental Disorders, the 5th edition, for the DSM-5-TR. Osmosis, 2020, July 6, Social Anxiety Disorder, Causes, Symptoms, Diagnosis, Treatment, Pathology, YouTube video. Stanford Medicine, 2020, March 3rd, Anxiety, Signs and Treatment Options for Anxiety Disorder, YouTube video.